Okay, so really excited again to have another amazing discussion with a very special person and on a topic that's very important. This is Dr. Sam Durso. Dr. Durso is the Mason F. Lohr Professor of Medicine and Director of the Department of Medicine at Johns Hopkins Bayview Hospital. Has a special expertise in geriatric medicine or caring for the particular and unique needs of the elderly. Thank you for doing this, Dr. Durso. I'm sure you're super busy.
Yeah.
So the first question I have, and I think this is something that we're all dealing with, is as medical providers, but also as family members and friends and neighbors, is what are the particular challenges that COVID-19 poses for the elderly that maybe, is not something that we're all necessarily thinking about?
Yeah, I would characterize three things. One is the risk of infection itself. The other is isolation. I think it has a very big impact on older adults. And the third is maintaining their health because many older adults have chronic conditions and they need management.
So age itself is a risk factor for infections. And then as people get older, they have more health problems that require regular caring for and checking up on. And then the elderly often, especially the way our society is, unfortunately, can be alone or isolated.
Right.
So how, what is ways, or what are the sort of best ways for the elderly patients themselves, the older patients themselves who may be having some struggles? What are the best ways for them to cope with these specific challenges?
Yeah, well, many of the older patients that I'm seeing are very diligent about social isolation. They recognize there's a risk. The downside to that, obviously, is that they're not getting out as much, and they're often not being able to really see family and friends. And some of them are afraid to go to get health care. I've had patients who were resistant to going out and getting their flu vaccines or getting updated in their pneumonia vaccines, just an example. And then we know that particularly during the surge, as they call it, the time between March and maybe sometime this summer, when hospitals were full and doctors' offices were really limiting the number of in-person visits that they could have. A lot of people chose not to come in for in-person visits. And as you well know, the elderly, many of them have hypertension, diabetes, heart disease, lung disease, and depression and anxiety. And all those, while their telemedicine has been a boon in some ways, there's really no substitute really for sitting down with a physician and the nurses and getting the care that they need. And so I've seen, and there has been reported, as you're well aware, that that there are individuals who have not only not gotten their immunizations, they've gotten their regular screening that they might have gotten, and then the management of diseases like lung disease and heart disease, which are not static and require adjustment medications in response to symptoms.
Yeah, people, I guess, aren't getting their medications filled, and maybe sometimes they have some conditions that are progressing. And if there wasn't a pandemic, they maybe would see the doctor earlier in the course of this sort of exacerbation of the condition, but now they're pushing it off and maybe to the point where it's too late.
Yeah. And we also see with mental health, it's probably true that many older adults, because of social isolation, are under more stress than they would have been. And then I have, a subset of patients that are having trouble with memory and perhaps orientation. And the way that many of us stay oriented and engaged is because we're going to work or we're encountering people, and that keeps us grounded. And so when people are at home without stimulation, that often shows itself as progression and worsening. And that's been a serious risk to this pandemic.
Plus also people are maybe not eating well, maybe not sleeping well,
yeah,
and certainly not going out and exercising. And these all can significantly impact people's health, both psychologically and medically.
Yeah, no question. I've seen that too. So, there's been this, this term that people have called the COVID-10 pounds that people gain.
Out of the COVID-19, I thought that's how they got the name, right?
Yeah, right, right, exactly. And a lot of that, is because they're at home more, sitting more, and then they're snacking, and you see that. And 10 pounds here or there may not sound like a lot, but when you're diabetic, that can make a big difference. When you're managing hypertension, that can make a big difference. And if you have to be sodium restricted, unless you're very diligent, you're probably taking in more sodium. So patients with heart failure, I saw someone today, in fact, that probably had tipped over. That's because they're eating more and they're not that conscientious about the salt content that's in their food.
Yeah. Okay. So then, what's some strategies for patients, for elderly people, to sort of stay healthy with all that's going on, balancing staying healthy with staying safe.
Yeah.
Right? We need to find that balance.
Yeah, I think that one is, that I think people should appreciate realistic risks. What I mean by that is getting outside and walking in the open air is a very low risk activity. If you're in a safe neighborhood, that's a very low risk activity. The chances of getting COVID in that kind of environment is extraordinarily low. And so I would just encourage people to get out during the day. The weather isn't going to get better probably with the winter, but sunlight matters. It resets our circadian rhythm.
We're all experiencing that right now in the dark at 5:30.
Right. So that sleep clock that is important, and keep people grounded in their routines like that. So there's that, I would say. I think the other thing is that, I hear people that sit at home and they're watching TV. You can still get on the telephone. You can still use FaceTime. You can still, you're more sophisticated or have help with it, can get on Zoom. And in our community, there's Sheeram and, many opportunities to engage, but there's even social activities with family. And I think all of those things are important. I don't think any one of them is a prescription, but I think if you put it together, it matters. I do think that, we all psychologically, probably give ourselves a rationale for eating a little more and differently, when you're bored and so forth. But, I would encourage people, if you're going to snack healthily, fruits and vegetables, for instance, and be cognizant of that.
Right.
Things haven't changed, just because of the pandemic. And
your metabolism doesn't know there's a pandemic.
Yeah, exactly. And then I think regular structured daily activities. So it's not uncommon that, people that are living alone or have very little external stimulation will let themselves stay up later watching TV, looking at a screen, for instance. We know that interferes with the brain's ability to turn off and go to sleep, and then to get up at a regular time. And I strongly encourage patients that I'm seeing to set their regular times for sleep. If it's 10 o'clock, get to bed, start relaxing, stop looking at a screen, get up, if it means even if you're a little sleepy, at a regular time. Don't stay in bed till 9 or 10 even, that I sometimes hear about, because it just gets worse. It's not going to get better. And then if you do feel sad, or even if you don't feel sad, but you feel like you're aimless and anxious, then you need to talk to someone about that. And maybe I'd start with your physician. But, even if it means talking to your, family about it, that's not one of those things to keep covered up.
So keeping a regular schedule for sleep, eating healthy, getting out and exercising, talking and staying in touch with family and friends are all important. What can people, though, do for the elderly themselves? What can we, as the non-elderly, friends, families, neighbors, do to help those folks stay healthy and not sort of fall into any traps?
Yeah, so I think is to kind of turn the mirror around. And what I would say is everything we just talked about for, what people can do for their self-care. I think we should be vigilant. Sometimes friends, family, parents, perhaps, I think that it's helpful and incumbent on us to be aware. I remember Rabbi Hauer making a strong appeal a number of years ago for us to care for each other, and that meant to look out, call people, see how they, if they don't show up at shul or they're not participating in this case, Zoom sessions that you're accustomed to seeing them at. Reach out, call them, that's one thing. I think we can do things for people too. I mean, there are many services available, but friends can buy groceries or go places for people that need that kind of help, or make sure they're getting their prescriptions filled and get them to the doctor. Again, I know there are people who worry about going out and getting into doctor's offices and so forth, but if you're going to a responsible healthcare facility, they're following the guidelines. And if you follow the guidelines, it's almost unheard of for people to get infected with COVID. I mean, there's going to always be some story about it, but the reality is that if you're following the guidelines, 6 feet, wearing your mask, and there's some particulars in certain circumstances when you're in elevators and all that. The chances that you're going to get COVID, certainly at a physician's office or a responsible pharmacy or business, is very low.
Yeah, and in fact, the risk to your health of not going to the doctor is far greater than the risk of you getting COVID.
Absolutely.
In that case. So what are some signs, like let's say, I have a grandmother, a parent, what are some signs that I might look for? Because, I know that elderly people don't always manifest symptoms of certain things like depression and stuff like that the same way younger people do. They may become withdrawn or just stop eating or lose weight. What are things that we can look for when we're checking in? If you're checking in with grandma, what are the things I look for that's sort of a sign that something's not right?
Yeah, I think that's a very good question, and I think it's an important one to raise because you're right. Not only do physical signs change as people age, sometimes the presentations of conditions like you mentioned, depression can change. It turns out that in older adults, for reasons we don't really understand, many won't express sadness. They will say they'll deny that they feel sad, which has been a classic screening question for, or are you depressed? Do you feel sad? And they may not, but like you said, they may do other things like, they may sleep longer than they should. They may have trouble getting to sleep, of course. That's a kind of a classic symptom. They change their eating. Sometimes we talk about not eating, sometimes they overeat. I mean, that's true for young and old, frankly. But, it changes, I would say, in patterns like that are becoming significant. I mean, I wouldn't, by all means, I'm not recommending that we hover over people because they want to eat an extra piece of dessert. What I'm saying is, that if you see a pattern developing, where they're getting up later in the morning or they're reporting they're kvetching because, that this hurts and that hurts, it may be that something hurts, but it could also be that, they're trying to express themselves. And so I think when you hear those kinds of changes, I'd say your antennas should be up, ask questions. How are you feeling? What do you think? Are you concerned? Is there something missing? What could I do that would help you? I think those are the things that we can do.
You can also look for the things we just talked about before. Is there weight changing? You can ask them, are you sleeping? Are you eating right? Are you doing, people have hobbies, people have activities. Are they doing their normal activities? And if not, maybe so let's say we find, you find out grandma or mom or dad is not doing those things. What is something like, what should we do to help? Like, how do you help in those situations? What can we do?
Yeah. So, one of the things I would remind us all about is that the older adults, like every adult, are a very heterogeneous group of people. We have different personalities, we have different skills and, cognitive abilities and so forth. It's a little hard to generalize. Family dynamics and relationships are complex and, and vary. So, it's hard to give, a statement that would cover all such circumstances. But I would say, just keeping in mind, for instance, that they're independent individuals. We don't want to infantilize adults, whether they're older or younger. But I would say asking how they can help. I'm concerned. I've noticed that, that you're not getting out of bed till 9 o'clock or 10 o'clock in the morning. I'm concerned that, that when I call, you're not, answering the phone. Maybe you can tell me, how you're feeling. I think respectful questions like that, opening up a dialogue, not fussing, not being directive either necessarily. I mean, I think that, it might be good to remind people that, you care about them and that you want the best for them. and how you can help. It may be that they'll come forth in that. And then you might have to suggest, you've got an appointment for the doctor. I think it's important that we keep it. Let me help you get there if that's relevant. But as I said, you have to, we say, cut the cloth to fit the suit. I don't know that I could give one recommendation that would cover everything. But I do recognize that that older adults are independent people with many of them functioning very well.
Listen, they live that long, right?
They live that long. They've been doing very well, and in many cases, they know themselves and they know their body. So I'm also, I want to caution that I'm respectful of that too. That that I think that we have to keep in mind that sometimes they have their own sixth sense about what makes sense for them. So
yeah, I guess, and family members will have a sense of what the functional and independence of the person is to begin with, and you can use that as your benchmark.
Right.
And so you kind of know how much does mom or grandma or dad need help with stuff beforehand, and maybe just pay a little more attention in the pandemic than maybe you would have during normal times.
Yeah. I would say red flags, though. I would say there are some red flags I'd pay attention to, and one would be if there really are abrupt changes in function. And when I'm saying function, I'm talking about both mental and physical function. Everybody has their ups and downs, and so this is another one that you have to be careful. I'm not saying if someone said I can't remember her name, that's not an alarming thing.
Right.
I misplaced such and such, if that's just not a regular pattern. But what I would say is that if you see that there's a dramatic change in function, people are not, managing their bills in their checkbook, or they're not managing, that some of the simple chores around that they were doing, self-care, that they were perfectly capable of doing, or if you see, if someone that for instance, this is not an uncommon thing, that has, let's say, a person that has some cognitive impairment, it's mild, maybe they live alone, they're still functioning pretty well, but then all of a sudden you see that, they're, not taking care of themselves, and they're clearly forgetting things like their medications aren't getting, they don't need them filled as quickly because they're not taking the pills. Those are red flags, and that's a time where hopefully you've done the homework before, that you've developed a relationship and they welcome your stepping in. But you don't want to let somebody just fail. And I guess one last thing I'd mention, I meant to mention it, was falls. Falls are, standing upright is a complex activity we take for granted, but increased risk of falls is a real red flag that something's wrong, something's not right.
Right. Well, so essentially it sounds like pay attention, use your common sense, and just, be on but be alert, but don't be, overly, I guess, obtrusive would probably be the word I get to get right.
That's right. Yeah, I think you have to find that right balance. That's
right. Thank you so much. This was super helpful. I'm going to, hopefully everybody will listen, pass it on to their friends and family. I think this is really important. So thank you, Dr. Durso. For everyone else watching, take care of yourself, and probably more importantly now, take care of somebody else, because that's what we really need now. I really appreciate it.
Take care.